Johnson. I'm Laura. I'm going to be your nurse today. Can I take a look at your bracelet there? Thank you. So how are you feeling today?
Good.
Good. You know where you are?
Yeah, I'm in a hospital.
You're in the hospital. Do you know why you're here?
I had a stroke.
You had a stroke. Good. Good. So I am here just to kind of check on you, doing a little assessment, see how you're doing.
Okay.
So can you tell me what the date is today?
It is August 1st.
Good. All right. So I'm going to pull this away. Do you need a sip of water or anything before I do? Oh, I see you're coughing, choking a little bit on that water, huh? Has that happened before?
No.
No?
Not usually.
Not usually. Okay. So I'm just going to do a quick assessment. We're going to listen to your heart, lungs, and kind of check you out and see how you're doing. I'm also going to do a little bit of assessment on your arm and your leg to see how the stroke affected you, okay?
Okay.
All right. Let's get started. Oh, you what? That was funny. Okay. Okay. All right, everything sounds good. Now I'm going to listen to your stomach, okay? All right, that all sounds good. Do you mind if I take your socks off here?
Nope.
Okay. Are you having any pain today?
Just a little.
Just a little, okay. What would you rate your pain at?
A 4.
A 4, okay. Maybe I can call your doctor and see if we can get you something for the pain too. If it gets worse, you let me know, okay? All right. Everything looks good here too. Okay. So now we're going to do an assessment on your arm and your legs, just to see how the stroke has affected your strength. Okay. So what I want you to do is try to reach for my hands here. Oh, that one's a little bit weaker, huh? Can you squeeze? Okay. Put that one down. Good. Okay. Now can you lift your left leg up? Good. Can you push against me? Nice. Okay, let's do the right leg. Okay, let's do it. Can you push? Oh, it's not working quite as well, huh? Okay, so from my assessment, I think I'm going to call your doctor, and I'm going to, from the swallowing, the choking when you were swallowing, I'm going to have a speech therapist come and meet with you. They're going to do a swallow study just to make sure that everything's going right, that you're not aspirating any liquids. We're going to make sure before we have you eat anything or drink anything more that's checked out. Then I'm also going to have a physical therapist come and meet with you to do some exercises on that leg, just try to do some strengthening things, get you up walking, probably have her bring in a walker and help you use that. Have you used a walker before?
I've not.
Okay, so she'll come in and she'll explain how to use it for you and help you with that, okay?
Okay.
All right, Dr. Milgrove, this is Laura, the RN. I am just giving you a call on our patient Gladys Johnson. I just went in and did my assessment, and it looks like she's in a little bit of pain, so I'm hoping that we can order her something for pain medications. And then also, she had a little bit of struggle swallowing, so would like to have a speech therapy consult. And with the weakness in her right leg, I think she would also benefit from a physical therapy consult. Great, thank you. Hi Jeannie, how are you today?
I'm doing well. How are you?
Good. Say I have a patient I'd like to coordinate with you on. Her name is Gladys Johnson, and she recently had a stroke and will be discharging soon. So we're looking at getting her into some transitional care and looking for some options for her.
Okay.
Would you be able to help her with that?
Yes, definitely.
Great. So we're going to have a meeting, like a case conference this afternoon about her around 3:30.
3:30?
Yeah.
Okay.
Will that work for you?
Yep, that will.
All right, well, we'll see you then.
All right, great.
Thank you.
Hi, Mrs. Johnson. I'm Roxie, and I'm a speech-language pathologist. I'll just be assessing your swallowing today and make sure that there's no pain or discomfort and that everything is, when you swallow, is swallowing correctly. So we're just going to do a couple quick assessments and just make sure that everything's working all right. So they're going to be really simple and painless. The first thing we're going to do is just assess your throat. So I'm just going to have you open your mouth, say ah, and then look in there. Does that sound all right?
Mm-hmm.
Say ah. Perfect. Can you stick out your tongue and move it side to side? What about up and down? Good. Now I'm just going to have you take a couple small sips of water, and we'll see if you have any discomfort when you're swallowing. Was that a little uncomfortable?
Mm-hmm.
Okay, so now what we're going to do is do another one. This time I'm going to feel your throat while you swallow 3 ounces of water, and you have to just keep swallowing it. Don't take small sips, okay?
Okay.
Okay, Mrs. Johnson. Based off my swallow screening, I'm going to recommend that we put you on a pureed diet and thickened liquids. Okay? And I'm also going to recommend to your doctor that we have a nutritionist come in. Okay? Have a good day.
Hi, Mrs. Johnson. My name is Joy Murray, and I'm going to be your physical therapist today. How are you doing right now?
Good.
Good. That's good to hear. I hope you're excited for physical therapy today. We're going to get you moving, kind of see where you're at, and at any point let me know how you're doing. We're going to just walk around the hall. I hope it's comfortable, and just let me know if anything happens. How does it feel?
Good. Not too tight, just perfect.
Good. So when you're walking with the walker, actually I should show you first. When you're walking, you're going to slide it forward first, and then you're going to step with your good leg, your left leg, and then you'll bring your right leg in. So I'll have you stand. And I'm going to just stand behind you, or to the side of you. So I'll have you slide forward. Good. Step with your left. Good.
I feel like we can cut it here.
Good job. You made it really far today. You're making progress. Go ahead and sit down. And take the belt off of you. Then you can lay down and relax for the day.
Thank you.
get you all tucked in here. Then you have your call light over here, so if you need any assistance, just ring.
Thank you.
Have a good day, Mrs. Johnson.
You too.
Hey everybody, I'm so glad you guys could make it today. We're going to have a care conference on our patient Gladys Johnson. I know we've all done our assessments now, and she will be discharging later today, and I've asked Jeannie to come as well so that she can help her transition with her discharge plans into the transitional care. So I did my assessment earlier and thought she needed some assistance from you two. So I'd just like to hear what you guys assessed when you were in there. So Joy, what did you think?
So what we did is we went on a walk around the hall, around the nurses station. She made it farther today, probably about by 50 feet or so. She looks strong when she's walking, but it would probably be good if somebody was helping her walk, maybe just making sure she's stable. So we used the gait belt today, so probably just having somebody walk with her, and then just progressing and how far she's walking.
So I think it would be beneficial to have physical therapy in the transitional care. And
Yes.
I assessed her swallowing and I did notice some dysphagia. I recommended to her that she would be on a pureed food diet or thickened liquids, and I spoke with a dietitian about that, and she went in and talked with Mrs. Johnson about it. So that would be something she would probably need to carry through to the transitional care center, and they could assess her there as well to see if she makes any progression with her swallowing.
Okay. I guess at this point, I can go in and talk to Mrs. Johnson and see if she has a preference of where she goes for this transitional care, and if the transitional care has a room for her. And we will set up physical therapy, occupational therapy there, and see where she goes from there.
great. Well, thank you guys all so much for assessing her and meeting today, and I think we have a great plan for her going forward.
Thanks. Hi, Mrs. Johnson. I'm Jeannie. I'm the case manager for the hospital here. How are you doing?
Good. How are you?
I'm doing well. Well, we had a meeting with your care team, and upon your discharge, we recommend that you get transitional care from a facility. Is there a preference that you prefer?
Just
Place to
close
go?
to my family.
A place that's close to your family? Okay. And then is there any concerns on how you'll pay for this care?
No.
No? Okay. Well, I think that the transitional care would be great for you. There you'll receive more physical therapy, and they'll work on your nutrition and your diet, making sure that the swallowing improves. And from there, the transitional care will make decisions upon your discharge or returning home, what assistance you'll need, and further care from there. So, is there any questions you have for me?
Sounds great.
Okay, I bet you're happy to get out of here.
I can't wait.
Okay, well, I wish you the best of luck, okay? If you have any questions, feel free to give me a call.